Morning. How are you? Oh, can you get my little diagram clipboard? So we're doing a live stream now. So thank you very much for allowing us to do this. I think this is going to be very educational for us, for everyone today. But I've already seen you before for consultation last week, so I'm going to kind of just go over your history and you just let me know if anything's incorrect. Okay.
Yeah.
So you are here for a feeding tube removal, a peg tube that you have in your stomach.
Yeah.
That was placed by a GI doctor because you had accidental overdose from drug use, correct?
Yeah.
And the drug use made you unconscious, right? And you weren't able to swallow well. So in order to give you nutrition through your intestines, while you're in the hospital, the GI doctor put in the tube that went into your stomach and you're able to get the tube feeds through that way, correct?
Yeah.
But you have since recovered quite significantly, so congratulations. And you are able to eat solid foods and eat normally over the past several weeks, correct?
Yeah.
Okay, good. So because you are able to take your nutrition normally by mouth, you no longer have need for the feeding tube, so we can go ahead and remove that. Okay,
Yeah.
so congratulations. Hopefully your case will serve as a reminder to other people the dangers of drug use. But you are pretty much fully recovered from your drug use, right? The only from the incident, right? The only residual effects you have is some speech issues, which you're working with a speech therapist, and that's improving, correct?
Yeah.
And then some function with your hands.
Yeah.
Is that correct?
Yeah.
Okay. All right. But that's also getting better?
Yeah.
Good. Congratulations. So what we're going to do is we're going to remove the feeding tube. And I have a little diagram of the feeding tube. So can you show us real quick the feeding tube in your stomach? So right there, right? And then this is where some of these lumens is where they insert the tube with the tube feeds and then they use it to flush it, correct?
Yeah.
All right, so you can put that down. So here's a picture of what we're gonna do. This is your feeding tube here. This is a cross section of your abdominal wall. So this is your skin, this is your fatty tissue, this is your muscle. This is the feeding tube that's going through your skin. So lift this up again. So this part is this tube right here,
Yeah.
and then it's going down into the stomach like that. So it's going through your abdominal wall. They have a little bumper in here, which is keeping this intact or in place
Like a stopper.
into the stomach, right? So when we remove it, we just give it a nice. So when we remove it, we're gonna have you lay on the table.
Yeah.
I'm gonna put my foot here and just yank out like that.
Yeah.
So really, really hard yank. So this little rubber stopper is just going to fold in with the force I'm gonna pull. It's gonna fold in and come right out. So you're gonna be left with a little opening that's from your skin to your stomach, which is called a gastrocutaneous fistula. And that pathway amazingly heals on its own. So all we have to do is just put a firm yank, pull it out, and then over the next couple weeks, the opening will seal up on its own.
Yeah.
Okay?
Yeah.
Any questions?
No.
You ready to get rid of this?
Yeah.
All right, so let's have you lay down. Just clean this area up. This is a little cold. So we're gonna pull it on the count of 3, okay?
Yeah.
You ready?
Yeah.
All right. 1, 2.
Yeah.
That's it.
Yeah. See.
So there's a little bumper that was holding it in there. That's the opening of the gastrocutaneous fistula. And amazingly, over time, this will heal up on its own.
Okay.
So nothing else needs to be done. Let me put a bandage on that, and then you'll be good to go. Was that too bad?
Yeah.
That was pretty good, right? You did good?
Yeah.
So how often we gotta put a new bandage?
Just as needed. I'd probably do it once a day at least.
Okay. It's like we were doing with the patch.
With the what?
The patch he had, for leaking and stuff.
Yeah, you just
And
need a
we were doing it once a day, every day.
you just need a regular bandage for this.
Same thing.
All right. Let me just clean that up. So she's gonna wipe off the extra betadine, and then he'll be good to go.
Okay.
All right.
Okay.
Everybody is saying thank you for letting him tell us his story and watch the procedure. This was great.
See you.
Thank you.
All right. Take care.